Hello and welcome to Maxi Health, where your health comes first. And this is a doctor's perspective segment of the show. My name is Rhoda Morakinyo, and today we'll be talking about a medical condition called febrile convulsion. To help us break down this big topic, we have a medical doctor in the house. She's a general practitioner and active volunteer for NGOs, especially those taking care of vulnerable children. Please welcome Dr. Titilola Olaguju.
Hi, Rhoda.
Hi, it's nice to have you here on the show.
Such a pleasure to be here today.
How are you doing today?
I'm doing great, thank you.
Okay, so let's get right to it. Febrile condition, this febrile convulsion, rather, is said to be a condition that affects children at the ages of between 6 months and 5 years. And some doctors have said it's caused by a spike in body temperature, while some have said this spike in body temperature happens, during or after the seizure has occurred. From your experience as a doctor, what would you say is the cause of these seizures, and what are the symptoms parents should look out for?
So, like you rightly said, febrile convulsions, also known as febrile seizures, are convulsions that happen most commonly in children between the ages of 6 months and 5 years, often when there is a rise in body temperature, say greater than 38 degrees Celsius, and anything that could cause a fever in a child, like anything that could cause an infection or even malaria. Malaria could cause a fever, can be said to cause a febrile convulsion.
Okay.
Also, there is a genetic link to it in the sense that if there is a history of febrile convulsion in, say, the mother or the
family,
father,
okay.
then it's likely that that child too is also likely to have a febrile convulsion. If the child has a fever, then occasionally when children have their routine immunizations, vaccinations,
Okay.
we do know that as a side effect of that, they could have a fever, and then the fever sometimes could be associated with febrile convulsion.
Okay, so sometimes the sicknesses that affect children can lead to them having this convulsion.
Exactly.
And we can't say it's like a form of spiritual attack, like it's a popular myth in this part of the world. When you have a child convulsing or having a seizure, people associate it to maybe an attack or something that village people caused.
Not at all.
Okay, so it's totally a medical condition,
Yes.
and it can be monitored or cured. I don't know if you can shed more light on that. How do you go about helping a child in that condition?
Okay, so before we talk about how to help a child in that condition, I think it's important that we establish what are the symptoms you're looking out for. How do you know that a child is having a febrile convulsion?
Okay.
Now, for most children, some might go unconscious, like the whole body might just become stiff, or some start shaking, their hands, their feet, all parts of their body are shaking and they're jerking. For some, there could be an upward rolling of the eyes. Some could foam at the mouth. Then some could even wet or soil themselves. Then in some children, you could have what is called a post-ictal sleep, which is when the child sleeps for a prolonged period following a febrile convulsion, sometimes lasting hours.
Wow.
Yeah.
So that's a lot of symptoms, and it seems to get worse. It seems like they have a degree at which the convulsions expand or extend to. Does that mean that, okay, these febrile convulsions can be worse, or maybe these symptoms can be little, varying depending on the child or something?
Exactly. So, not all children who have fevers would convulse.
Yeah.
So, like we established, the chances of a child having a febrile convulsion is higher if there's a family history of febrile convulsion.
Yes.
Exactly. And then depending on the degree of the fever, how high the fever is, that would also say to a large extent how long a febrile convulsion might last.
Okay, so that means the child has a tendency of, probably getting better if the child doesn't have if the family doesn't have the history, or maybe the child hasn't been going through a particular illness at that time.
Exactly.
All right then, doctor. So, what should the parent or guardian do when they see the symptoms, the jerking or stiffening of the body or eyes rolling to the back or something? What would you advise a panicked parent can just, be, panic and just be in fear or something? What do you think the parent should do at that time?
Okay, so like you said, it could be a really frightening experience for parents, especially if it's the first time you're witnessing your child
Something like
having
that.
a febrile convulsion, and the natural instinct as a parent is to try and help the child in whatever way you can. So we advise that as much as you can, try to be calm. You need to be in control of the situation, because oftentimes febrile convulsions will run their course. It's not going to go on forever. So you have to be really patient, be calm. First thing to do is make sure the child is in a safe environment. So you look around, is the child in a place where he or she cannot hurt himself? So you want to make sure that whatever can cause any injury, like any sharp objects, you remove from
that area.
Exactly. And then if the child has a tight piece of clothing on that could obstruct the breathing, you want to loosen that so that the child can breathe well.
Easily.
And then it's important that you place the child in the recovery position. When we say the recovery position, that means you position the child to lie on the left side, because that way you open up the airways and the child can breathe well.
Okay.
And then it's also really important that you do not attempt to put anything in the child's mouth. Be it medicine or water or a finger, nothing at all. Because the danger with that is likely that the child is going to aspirate, which could lead to a lot of complications, and then the child could also hurt the person, especially if you are putting a finger in the child's mouth. Just let the child be, and then when you're calm, try to note how long that convulsion has been going on, because those are some of the things your doctor would want to ask you when you go to the hospital. Wait it out, let the febrile convulsion run its course, and then you can see your doctor.
Okay, so in other words, when this happens, parents are almost literally advised to do nothing. Basically, in layman's terms, the natural instinct is for the parents to, okay, let's do something. Let's pour water. We see that a lot here in Africa. They'll pour water, or I remember you mentioned something about a spoon. Most times when a child has a seizure, they put a spoon in the mouth or try to keep the mouth open. Do you have an idea why that should be like a thing? Because it must have generated from somewhere, the habit of trying to force the mouth open or put a spoon in there. Do you have an idea?
So because oftentimes when a child is seizing, the teeth are clenched and the jaw is closed. So that in itself is a scary situation. Able to open the mouth again after that, or the child will be able to breathe, which really isn't true. So long as the child is well positioned, the child will keep breathing fine. So you really don't have to do anything. You only make the situation worse when you attempt to put something in the mouth, because you can make the child then bite his or her tongue and then aspirate some fluid into the lungs, and that could be really dangerous.
Okay, so really the whole spoon thing is a myth.
Is a myth.
Wow. Okay, thanks for clearing that up. So apart from the spoon and then trying to force them out open thingy, the next thing that the parent should try to do is to make the child comfortable. That means the parent themselves have to be really calm for this to happen. So I don't know if there's an advice you can give to parents to try to calm themselves down, because their mental health is also at stake at this very delicate period where their child is convulsing. It might be the mom, it might be the dad, it might be a concerned sibling that is around at that time. What advice would you give to a parent or a guardian to firstly calm themselves so that they can help the child?
Okay, so I believe information is power. Now that parents know better, they know that it's not about putting a spoon in the child's mouth or trying to give the child any medicine that's going to make the child better. That should in itself empower you to stay calm, and then you can, whatever would keep you calm at that moment, you could talk to yourself, you could take a deep breath, just be calm. Exactly. Whatever.
Take a deep breath, or maybe count to 10, or whatever is going to just keep you sane at that time. Okay, that's really good advice. So once the parent is calm, they can obviously be in a state of mind to help the child, or just wait it out. You said something about timing the convulsion. Is there? I think I read something about the febrile convulsion, and the doctor said it usually runs for about 10 to 15 minutes. I don't know if that's another myth or it's a medically proven fact.
So how long a febrile convulsion would last would vary from child to child.
Okay.
Because as we previously established, it's going to depend on a number of factors, like how high the fever is,
if it's genetic.
So generally, you just want to be sure that rarely with febrile convulsions, most febrile convulsions won't last more than 5 minutes. Although to a frightened parent, that might seem like
forever.
Like forever, but in most cases, they rarely last more than 5 to 10 minutes.
5 to 10 minutes.
They rarely do.
Okay, so I guess that should be relieving to someone who's just learning about this for the first time. But okay, don't panic, don't worry, it's going to be over very soon. Just try to place the child in a comfortable position and wait it out and time it so that the doctor can be made aware at a later time. Okay, thank you very much for that. There was something else I was wondering. This condition sounds very similar to another condition called epilepsy. So an epilepsy is, I don't know, another really, really scary word. Are they related? What do you have to say about that?
Okay, so they're quite similar, but they're not exactly the same thing. A lot of people think or equate febrile convulsions to epilepsy. No, like we said earlier, febrile convulsion is a convulsion that is associated with high fever, and most times often in children. While epilepsy is a series of repeated, unprovoked seizures that occur as a result of abnormal electrical discharges in the brain. So it has nothing to do with a fever. There are other causes associated with epilepsy. And epilepsy could be caused by a brain tumor, it could be caused by a stroke, it could be caused by an infection, but it is not exactly caused by
a fever,
body temperature.
So epilepsy is really more serious than a febrile convulsion, and it's not associated with the age.
No,
because febrile convulsion is associated with little children. So epilepsy can actually occur in adults.
Any age group, yes.
In any age group.
Young children, adults, the elderly, so any age group.
So in other words, these conditions really have to be confirmed by a medical doctor.
Yes.
And not just, speculated by the parents.
Yes.
Okay, thank you very, very much for all this enlightening explanation, Dr. Titi. It's really nice to have you here. We hope to have you back sometime soon. Thank you so much.
You're welcome.
All right, with that, we've come to the end of today's episode of Maxi Health, where your health comes first. I hope you learned a thing or two about febrile convulsion and the difference between that and epilepsy. We hope to see you very soon. My name is Rhoda Moraki.